Welcome. Today we're delving into a rare and often overlooked condition affecting the urinary system, bladder neurofibroma. This video will provide a comprehensive overview, from understanding its causes to exploring treatment options. We aim to shed light on this condition and empower you with knowledge. The exact cause of bladder neurofibroma remains largely unknown. It's believed to stem from the abnormal growth of nerve sheath cells, specifically Schwann cells within the bladder wall. While often occurring sporadically, it can sometimes be associated with genetic conditions like neurofibromatosis type 1, also known as von Recklinghausen disease. In these cases, a genetic mutation predisposes individuals to the development of various neurofibromas throughout the body, including the bladder. Bladder neurofibromas develop when Schwann cells, which normally support and insulate nerve fibers, begin to proliferate uncontrollably. This abnormal growth results in a benign tumor within the bladder wall. The location and size of the neurofibroma can affect bladder function. The tumor may compress or irritate the bladder, interfering with its ability to store and empty urine effectively. This disruption can lead to a variety of urinary symptoms. Bladder neurofibroma is considered a rare disease. Its exact incidence and prevalence are difficult to determine due to its often asymptomatic nature and the challenges in diagnosis. It can occur in individuals of any age, although it's more commonly diagnosed in adults. Those with neurofibromatosis type 1 have a higher risk of developing neurofibromas, including those affecting the bladder. Further research is needed to better understand the true frequency of this condition in the general population. Many individuals with bladder neurofibroma experience no noticeable symptoms, especially if the tumor is small. When symptoms do occur, they can vary depending on the size and location of the tumor. Common signs include a frequent urination urgency, or the feeling of needing to urinate even when the bladder is empty, dysuria, or painful urination hematuria, or blood in the urine, lower abdominal pain or discomfort. In some cases, larger tumors can obstruct the flow of urine, leading to urinary retention or hydronephrosis, a swelling of the kidney due to urine backup. Diagnosing bladder neurofibroma can be challenging due to its rarity and non-specific symptoms. The diagnostic process typically involves a combination of medical history and physical examination to assess the patient's symptoms and overall health. Urinalysis, to check for blood or other abnormalities in the urine. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder to visualize the bladder lining. Imaging studies such as CT scans, MRI, or ultrasound to visualize the bladder and surrounding structures and detect any tumors. Biopsy, if a suspicious mass is identified, a biopsy is performed to collect a tissue sample for microscopic examination. This is crucial for confirming the diagnosis of neurofibroma and ruling out other conditions. Bladder neurofibromas are generally classified as benign tumors. They are typically solitary but can sometimes be multiple, especially in individuals with neurofibromatosis type 1. Histologically, they are characterized by the presence of spindle-shaped Schwann cells and collagen fibers. There are no specific subtypes of bladder neurofibroma, but it's important to differentiate them from other bladder tumors, both benign and malignant. The treatment approach for bladder neurofibroma depends on several factors, including the size and location of the tumor, the presence of symptoms, and the overall health of the patient. Asymptomatic small tumors may be monitored with regular check-ups and imaging studies. Symptomatic or larger tumors typically require intervention. Treatment options include a transurethral resection of bladder tumor (TURBT), a minimally invasive procedure where this is removed through the urethra using a resectoscope. Partial cystectomy, surgical removal of the portion of the bladder containing the tumor. This is usually reserved for larger tumors that cannot be removed with TURBT. In rare cases, a radical cystectomy, or complete removal of the bladder, may be necessary if the tumor is extensive or malignant transformation is suspected. After treatment, regular follow-up appointments and imaging studies are essential to monitor for recurrence. Currently, there is no known way to prevent sporadic bladder neurofibromas. For individuals with neurofibromatosis type 1, genetic counseling and early screening may help identify and manage potential complications, including the development of neurofibromas in various organs. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may contribute to overall health and well-being, but there is no specific evidence to suggest that it directly prevents bladder neurofibromas. The prognosis for bladder neurofibroma is generally good, especially when the tumor is detected early and treated effectively. Most neurofibromas are benign and do not metastasize. However, regular follow-up is crucial to monitor recurrence or any signs of malignant transformation. Recent research is focusing on understanding the genetic and molecular mechanisms underlying the development of neurofibromas. This research may lead to the development of targeted therapies that can effectively control tumor growth and prevent recurrence. Additionally, advancements in minimally invasive surgical techniques are improving treatment outcomes and reducing the risk of complications.